Hi everyone, my name is Dr. Samantha Smith. I'm a home health physical therapist, hence why I'm recording this in my car. But I wanted to talk to you about what to expect when you get your knee replaced if you haven't already, or if you just got it replaced, what you should expect going forward. So let's talk about realistic expectations. After surgery, your new replaced knee will be better than your old arthritic knee, but it won't be a 10 out of 10. The knee you were born with before surgery and before you had arthritis is that 10 out of 10 perfect knee. However, if your current arthritic knee is like a 4 or a 5, your new knee after surgery should be like an 8, but it won't be a 10. It's important to know your symptoms will improve, but it will not be perfect. Second realistic expectation you'll need to know is PT post-surgery is just as important as the surgery. You'll need to be motivated after surgery to improve even with the pain. You will have pain, but it will improve as your tissues heal and you do your PT. I also like to discuss the quick and dirty timeline of what the healing process looks like after a knee replacement, specifically a total knee replacement here. If you haven't committed to the surgery yet, this will give you an idea of what to expect. Each patient is totally different, but a full recovery takes about 1 year. However, you should feel 50% recovered by 3 months, 90% by 6 to 9, and then that 100% by 1 year. So week 1, you'll have a lot of pain and inflammation. You'll really regret that you did this to yourself, but your pain will be manageable if you're taking your pain meds around the clock, you're focusing on icing and elevation, and you're doing your exercises. You'll need help doing things around the house though. You'll need supervision with some things that may cause you to lose your balance, like getting in and out of the car or taking a shower, and you'll be using a walker. By week 2, you will still have pain and inflammation, and you'll be taking the pain pills still. The mobility of your knee will start to improve, and you will be able to get around better, but you are still not comfortable doing things like the dishes, making the bed, taking out the trash. These things will still be hard, and you'll only be able to sleep like 2 or 3 hours at a time because the pain wakes you up at night. The stamina of your knee will be low, and you'll still be on the walker. However, each patient's different. You might be transitioning to a cane at this point. I've seen people go to a cane at 2 weeks, some at 6 weeks. It's so dependent on the person, how old they are, how was their strength and balance before surgery. At 2 weeks, you might notice some pain in your hip and your back and your ankle due to walking with a limp. By week 3, your pain should be improving, but you will still have a lot of swelling and aching, and it will be frustrating. You will be sick of the pain. You should be taking less pain meds by now, or you'll only need pain meds at nighttime. Getting on and off the toilet, on and off chairs, in and out of the car, it might be easier, but not 100% quite yet. You'll still need to use ice and elevation to help with the swelling and the pain. By week 4, your knee will still be achy, but you will still have a lot of swelling. You've got the hang of your PT exercises by now. Your range of motion should be progressing well, but you'll hate stretching your knee because it hurts like heck. And during the day, you will start to push your limits with your daily activities, but you'll have to sit down and rest often if you overdo it. You'll still have night pain, maybe. You'll be on the cane by now, or no device at all. By month 2 or 3, you'll be walking longer distances with minimal discomfort in the knee. Your knee might talk to you at the end of the day. If you had a full day of activity, you should feel comfortable with your knee at this point, and you should be still keeping up with your PT and your stretches to make sure you keep your strength. By month 4 through 6, you might still have swelling that comes up after a long day of activity, but overall, you won't really notice any pain. You'll be able to go on that vacation you've been putting off, and you won't have to worry about your knee anymore. After 1 year, your muscles in your knee, your hip, your back have now adapted to this new knee. You'll be pain-free, swelling-free, and you'll be able to do everything you want. You might notice some discomfort if you like jump or you kneel on your knee, but overall, should be really good.